Hello, my name is Rob Armstrong, and I'm the Chief Executive Officer of the YMCA of Simcoe, Muskoka. And with us today I have Carolyn Tong, who's the Health Promotion Specialist with the Heart and Stroke Foundation. And Carolyn and I are going to spend a little bit of time just chatting a little bit about the health of children and youth in Simcoe County and in our country. So Carolyn, question to you. In Canada, 26% of children and youth aged 2 to 17 are overweight or obese. Can you tell us a little bit about why you think that is and what some of the factors are that contribute to that?
Certainly. Well, as you know, Rob, there is a huge concern with children and youth right now with the rates of obesity and overweightness on the rise. And right now, if the rates continue the way that they are, it's a big concern because this generation of children may be the first to not outlive their parents' generation. Which is, of course, a huge concern to us at the Heart and Stroke Foundation, I'm sure for yourselves as well and many of our partners. And many of the reasons why we think that this is happening is because the way that children and youth tend to live out their daily lives is very different from the way children and youth used to live. For example, only about 7% of children and youth right now are actually getting the right amount of physical activity per day. And as Health Canada recommends, that children and youth should be getting 60 minutes of activity every day, and only about 7% of children and youth are getting that. And on top of that as well, children and youth are not having as much access to nutrition, healthy nutrition as they should be, and only about 50% of kids are getting access to enough fruits and vegetables every day. So it's quite a concern because we know that both physical activity and nutrition are very controllable factors in most children and youth's lives. And there's a lot of things we can do to help to prevent the rise of obesity and overweightness, and also concurrent with that, the risk of heart disease and stroke and various other chronic diseases. Heart and Stroke Foundation right now has actually got a Time to Start campaign that we've been launching with this back-to-school timeframe to help to educate and support parents to be able to bring healthy nutrition into their children's lives as well as physical activity. And there's a lot of information on our website at heartandstroke.ca, which helps to give parents the tools that they need to be able to have healthy breakfasts, healthy starts to children's lives every day, and also help to encourage them to have physical activities such as through walking or biking to school.
Great. Well, you might be interested to know, Carolyn, that the Y has just finished a new strategic plan, and the health of children and youth has become a big primary component of that as well. So we, over the next 5 years, will be working very focused on trying to increase the health of our children and youth here in Simcoe and Muskoka. What are some of the other projects that Heart and Stroke has had related to how you would be enhancing? I know we partnered again on some of those. Tell me a little bit about those.
Yeah, definitely. Our most recent partnership actually was only a few months ago. We had a Healthy Food, Healthy Youth Forum in Simcoe, actually in Barrie. And what we did with that is we partnered with the Y, Heart and Stroke and the Y partnered together to bring youth to the table, to get them engaged in coordinating a forum, to be able to involve partners such as public health or school boards. Some trustees were there from the school boards to be able to talk together about what exactly is it that youth are going towards for food, and how can we help youth to be healthier through the food that they eat. And it was quite an exciting morning. It was only a couple hours that we had, but we were able to get some really good conversations going with the youth and with partners, and that included some people from agriculture and restaurants as well, to be able to have a conversation about what we can do to increase youth's access to healthy food. And so from that, there were actually 3 projects that came out of it, one being to form community gardens or to help support community garden development in the Barrie area. Also, the youth were very interested in having a healthy food fair, and they wanted to have something where youth could be a part of helping to educate other youth about what type of healthy food is available, how to access healthy food. And there's going to be some partnerships and some pretty exciting movement around that. And then the third thing that youth brought up to us was that they wanted to have a conversation with us about how youth can access healthy food during the school day. So as you know, recently there was a new set of rules put in place in the schools regarding what kind of food can be sold on school property, and so that affected the cafeterias. but it doesn't really affect how zoning happens around schools in terms of what kids can access during the school day just off school property. And so there's going to be some conversations that will take place in terms of how can we cater cafeteria food to be something that would be appealing and interesting to the youth and would help them to want to make healthy choices. And also how can we also work around what's around schools and to get youth to have access to healthy food off school property near schools during the day as well. A lot of very interesting, exciting things.
Schools seem to be a really great example of where we can impact the health of kids. I know we've worked together on the Healthy Initiatives project in schools, and the Y is actually just about to launch through our strategic plan a project where we are working with teachers around the training of what's called a coordinated approach to children's health, which is a catch, and that particular program is going to be helping teachers learn a little bit more about how to keep kids active, new games and activities, stop with the lining up and the sort of standing around type of activity. And this has been accepted by the school boards and something they're going to roll out all across Simcoe County. That's a really good example, I think, of a whole lot of people working together to impact the health of kids. As we look sort of to the future, we've worked together. We've worked with the school board. We've worked with the county. What are some of the other things you would see maybe being able to work together on as we start looking at really impacting the health of kids here in Simcoe County?
Mm-hmm. Well, definitely, I think the Y has already been doing some amazing work here, and you've received support from us in doing some of that work through our Spark Advocacy grants. Actually, to date, you've received 3 Spark Advocacy grants from us to be able to work, particularly in the schools, and with partners related to the schools to help to increase physical activity for kids, for example, active safe routes to school, and encouraging schools to create their own policies around that so that they can be sustainable and encourage children to be active. And I think definitely the partnerships that take place between community partners like ourselves, as well as with the school boards and with the government partners, to be able to work on the infrastructure that supports children being active and having access to healthy resources in the community is very, very important. And I think we're definitely on the right track, and I think we've seen a lot of success already from the Spark grants that you have already applied for and received. And it's great now to be able to see the school boards starting to, and the public health unit take that up and start to move it forward and to keep that momentum going, and now it frees us up to be able to work on some other things like what you're mentioning as well, which I think it's a really great way for us to be partnering together and working towards raising the awareness about the issues, and also moving forward with some common goals to be able to keep our kids active and also help educate them about healthy nutrition and other lifestyle factors that they can make decisions upon.
You mentioned access. That's a big one, isn't it? I mean, the ability for kids to actually be able to have access to activities, sports, the food that they would like to eat. I know in other projects we've been on, particularly the food side of things, that's a big challenge. How do you think how do we overcome that? I know we've talked a lot about the knowledge that kids have getting in school around nutrition, but when they go back home, they also have to educate their parents. Mm-hmm. What would your thoughts be on how we might overcome some of that?
Well, I think there's a lot of research that's been done around access and what causes people limited access to healthy nutrition. Some of the statistics are that 40% of food bank users are actually children and youth, or people who are accessing the food banks for their children. And I think that speaks to part of the concern with access, that sometimes is that children and youth and their families don't have the physical means to be able to access healthy nutrition. And so that's part of where these initiatives like the Healthy Food, Healthy Youth Forum come into play, because there's ways for us to be able to deal with those determinants of health, let's say. So the things that are actually causing upstream the factors that are limiting children and youth's access to healthy food or nutrition. Another interesting statistic is that those children who are from families where the income is about 100,000 or more, so dual income families typically, tend to have much greater access to physical activity and recreation programs than children who come from like a $50,000 annual income, which is more like a one-parent family or a low-income two-parent family. So because of that, there's a lot of concern around access and socioeconomic status and people's ability to afford these types of resources. And when we have a community forum like the Healthy Food, Healthy Youth Forum, what that does is it brings in partners from social services, for example, and community partners that do outreach for high-risk youth or perhaps youth that have less access to those types of resources. And we get to start talking about those ideas and see, are there policies that we can have, or are there initiatives that we can start that can help to increase their access and possibly even to help encourage them to be able to make those decisions and work with the families and work within their context to be able to increase that access so that it becomes more equal across the span and not just for those that are on the higher end of the spectrum.
Right. And as you know, from an access point of view,